Hi there, this is Dr. Kimberly Olson, continuing our talk on differential diagnosis. Today, we're going to talk a little bit about ADHD and some of the externalizing disorders that folks often mix up. So here we go. Okay. So ADHD, inattention, doesn't pay attention to details, careless mistakes, difficulty with tasks that require sustained attention, doesn't seem to listen, doesn't follow through with instructions or homework, trouble organizing, loses things, easily distracted by extraneous stimulus, and or forgetful in daily activities. So that's the inattentive portion. So remember, guys, that you can actually have, there's three different types. There is ADHD predominantly inattentive type. So, I mean, those could be the folks that are like daydreamers. And again, this is why the inattentive folks don't tend to get as much attention as the folks that have more of the combined type or the predominantly hyperactive impulsive type, because these folks don't tend to cause a lot of trouble in a classroom. The folks that are primarily inattentive, again, that's where we're going to see more of our girls and our boys. And again, it's often overlooked or neglected because it might be perceived as somebody who is a daydreamer. Okay. Well, what about the predominantly hyperactive impulsive type? This is where you're going to get your referrals from your teachers. Fidgets, leaves seats, runs or climbs, unable to engage in quiet play, always on the go, talks excessively, blurts out answers and or interrupts. So if you're anything like me, when you read these, the first thing that comes to your mind is, wow, these things sound really developmentally appropriate for most kids. So remember, what defines a disorder is that it's causing social and or occupational impairment. Okay. And in the case of ADHD, it's got to be in two environments. So it can't just be at school and it can't just be at home in order for you to diagnose that. If you haven't watched my video on ADHD, the one where I talk about the fact there's nothing wrong with your kid, that ADHD folks are hunters, and in days of past would have been celebrated hunters, because hunters have to scan large amounts of information really quickly and be able to pounce at a moment's notice. So their skills were very much valued at one time in our history. Unfortunately, we've become a total farmer culture, and not that there's anything wrong with farmers. Farmers do farmers, hunters should do hunter things. Farmers, of course, like consistency. They watch their corn grow. They don't like surprises, for example, a storm, because it's going to destroy their entire crop. And we've become this farmer culture. So it's really hard for our little hunters to fit in and sit still for 6 hours in a classroom. But that's an aside. We're talking about differential diagnosis right now. So what about intermittent explosive disorder? Verbal and or physical aggression, but it's not premeditated. Okay. One of the things that I notice with my folks that have intermittent explosive disorder is there tends to be like a buildup of tension and a release that almost resembles a cycle of violence. So if you go back to the cycle of violence, you've got a person who suppresses, and explodes. Well, we see this with intermittent explosive disorder, just not necessarily in terms of domestic violence. It could be any type of explosive kind of behaviors. It could be yelling and screaming. It could be physical aggression. But I always think in terms of the hefty bag, right? That we all carry around a hefty bag, those old plastic garbage bags. And every time something happens that impacts our self-esteem, makes us angry, makes us feel invalidated, it's another piece of garbage in the bag. And then finally, this bag gets so tight that the last person who throws another piece of garbage in there gets it for everybody. Okay. And so once all of the trash is out, they have lashed out at that poor last person who did not deserve all of the trash to come out at them. Then they have an empty bag and it starts rebuilding again. So what I noticed really with these people is that they weren't taught how to express anger appropriately. Meaning that if you ever watch like watch a pressure cooker, okay, it lets off a little bit of steam, right? And it does that because we don't want the pressure cooker to explode. We want it to let off a little bit of steam at a time. And so what we need to do with these folks is teach them assertive responses in the moment. So we're not constantly shutting it down, shoving it down, shoving it down until the inevitable occurs, which is explosion. Okay. Oppositional defiant disorder, that I call stinkerism. Okay. You want to look for the following: often loses temper, touchy, angry, resentful, argues with authority figures, defies rules, deliberately annoys others, blames others, spiteful or vindictive. So these are just what I call stinkers. Okay. And the reason that I use that term is to help you differentiate between ODD and conduct disorder, because one of the things that is inherent in folk that were not taught proper diagnostic skills is if you have both ODD and conduct disorder on your sheet, because you'll figure that out in a minute. With ODD, I see more environmental factors, to be candid. A lot of guilt parenting or inconsistent parenting. So let's take, for example, we've got a lot of parents who are working, and so they want the time that they have with their children to be positive. And so what ends up happening is they let go of things that they should address. So like when their kid's being a stinker, okay, maybe they let it go, maybe they don't address it, or they don't address it in the capacity that they should, right? And so the kid learns that I can do this. I can be a stinker. I can be a stinker and get away with it. In fact, mom or dad are so guilt-ridden, they'll probably co-sign my bullshit, right? And so it's really, really sad, because what happens with our little stinkers is that when they get to school and they have a teacher in front of them who isn't guilt-ridden, they oftentimes will have problems in school following rules because they've been allowed to get away with things. And so one of the things that I see with these parents is I will just need to have a talk with them again about what our duties are as a parent, which is we need to be raising people who can function in the world effectively. And if you learn just to manipulate or to go over mom's head when she's giving you a directive that you don't like and go to dad, right? This is not going to translate well to the real world. I want you to imagine that I'm in an employment situation. Okay, it's not going to fly very well. Inconsistent parenting, again, creates stinkers. So if we inadvertently negatively reinforce behavior, for example, let's say you're on the phone and your child has learned that when you're on the phone, you're not as sort of rigid with your rules. And they say, I want a cookie. Give me a cookie. And you're like, no, we're going to have dinner in a little bit. And they're like, no, I want a cookie. I want a cookie. No, we're going to have dinner in a little bit, but I want a cookie. And then finally you're like, oh, the hell with this, and give them the cookie, right? Just to get the child off your back. Okay. So we have reinforced that that behavior will happen again. So we have to be really careful with this one, because again, I don't necessarily see inherent pathology with these folk. What I see is kids who have learned a way of relating in the world that is going to be very detrimental to them later on. And again, another example would be if you can argue with your parents and get what you want, then it's a natural conclusion that I can argue with teachers. Okay. And later in life, maybe I can argue with bosses and get what I want, because that's what they've been taught. It works. Kids are sometimes also taught that the rules simply don't apply to them. Okay. And again, that's usually the result of some type of parenting. And again, let's go back to this guilt construct. And we see this even in the schools. So it used to be the case, at least in the 70s when I was a kid, that if you got in trouble at school, you were going to get in trouble at home, even worse, because you embarrassed your mom, right? Today, what we see more often than not is there's going to be division between the teacher and the parents. and we got little Stinkerbell over here, okay, able to do what they want and get away with it because, again, the parent feels guilt and wants to back up their child, and they're not realizing that, again, teaching them to not work with authority figures is going to be greatly detrimental to their future. Okay. Inconsistent parenting. Again, if I can get away with it sometimes, and why not? I'm going to be a stinker. If I can get away with it with mom, why wouldn't I try it with you? Why would I need to listen to grandma or grandpa if I don't even have to listen to mom? So stinkerism, and we can absolutely intervene upon this, but a large part of the recovery is going to be with teaching parenting skills and things of that nature. When we go up to conduct disorder, most researchers agree that at this point there's likely a neurological component. So again, this could be like the poor impulse control that we see present in somebody with ADHD. It could be the perfect storm, so to speak, where we have folks that are maybe not as sensitive to environmental cues as others. And it could be the case that they've been traumatized and there was some issues as far as brain development and impulse control. But we're looking for bullies, threatens, initiates physical fights, uses weapons, cruel to people or animals, has stolen while confronting a victim, rape, fire setting, destruction of property, burglaries, lies, steals, stays out all night, has run away and or truancy. So notice that there are a lot of things in conduct disorder that we don't see with ODD. Okay. We are very much crossing over into conduct disorder when we start seeing behavior that is cruel. And not that all behavior isn't self-serving, but the ability of the person with conduct disorder to rationalize their behavior is profound. So, for example, when I was working at juvenile hall, I would have kids that would, cry, and I would think, oh my God, that indicates that, they have a conscience and they feel bad. But when you really started asking questions, they feel bad for themselves because they got caught, because they're having to deal with the consequences. But when you talk with them about the things that they've actually done, it's usually rationalized. Well, so-and-so shouldn't have done that to me. I wouldn't have kicked that kid's butt if so-and-so hadn't said this to me. Okay. Cruelty to people or animals, anything that's vulnerable. Okay. And again, that's where we also see some people argue. And again, guys, we have a lot of correlations, but we don't have causation. Remember, this is social science. Okay. We talk about kids that maybe haven't experienced empathy at home. So their feelings were never held in high regard, or when they were hurt, nobody was sensitive to them. So they've learned to be cruel and insensitive to the world. Now, that's not the case in all families. Okay. Again, that's why we say we got nature, we got nurture going on. We got lots of things going on here. When we see rape or forced intercourse, oftentimes I'll hear, well, she had it coming, she did A, B, and C, and so that's my rationalization. Stealing, well, he or she has more than I do. So we got rationalization. So we're not really seeing in the conduct disordered kid a real big conscience. Okay, at this point, again, we are seeing what is sometimes, not always, but sometimes a precursor to antisocial personality. So they often lack empathy, and the smart ones learn really early on how to fiend empathy or to pretend that they're empathic in order to manipulate you to get what they want. So I just have to watch new therapists around these people because, again, they're really, really good at presenting in the way that best suits them, which may or may not be the case. Because if a person truly doesn't have empathy for others, the way we approach them in treatment is going to be more about consequences to them. Okay. Not necessarily about, look how you made this other person feel. because again, if there's nothing there, there's nothing there, but they're always going to understand consequences to themselves. Okay, so here are the key differential diagnosis in a sentence. Okay. So problems noted with those diagnoses with ADHD are the result of being inattentive and impulsive, not actively defiant. Okay, so this kid is not a stinker. This kid got up and started wandering class, but as soon as you told them to go sit down, they did. And then they started fidgeting again and had a good hard time staying still. And maybe they got up again 5 minutes later. But as soon as you told them, go sit down, they go sit down. Okay. So they're not defiant per se. Now, here's where we run into issues. ADHD is often comorbid with oppositional defiant disorder, like 80%. I mean, the figures are outrageous. And I'm not sure if it's because we fail to distinguish, or if it's really that hard to distinguish, or if we've got somebody with ADHD who is already inattentive and impulsive, and we've got a kid with ODD who's already a stinker. You combine those two and you get a nice little storm there. Okay. ODD can be defiant, argumentative, and annoying. Okay. This is the result of stinkerism as opposed to the violence and pathology noted with conduct disorder. So conduct disorder is ODD on steroids. Okay. Oppositional defiant disorder, again, we're often going to be looking at parenting issues. We don't necessarily see pathology yet. Conduct disorder includes violence, destruction of property, and an overall disregard for the rules and rights of others. Okay, this is where we start seeing the pathology. And sometimes it's hard to recognize because even kids that I worked with at the hall already knew very much how to manipulate, okay, how to fiend anxiety or fiend empathy, and are very, very good at reading people. Okay. And then, of course, intermittent explosive disorder is marked by verbal or physical outburst, often resulting from suppressing negative feelings, but it's devoid of the pathology consistent with conduct disorder. Okay. So this person isn't like out hurting puppies and stuff. They are much more suppress. I've just exploded. I'm all over the place, but I'm not necessarily indicating other types of pathology, more sinister things. So ADHD, they're not actively defiant. They're just impulsive as hell. ODD, they're stinkers, but we wouldn't yet call them pathological. Conduct disorders, they have inherent disregard for the rules and rights of others. So we've got pathology going on in conduct disorder. Intermittent explosive, so they absolutely will have, they might hit, they might yell and scream, but they don't have the other pathology we see with conduct disorder. Okay. So those are your key differences. I hope that this helps. And in the next video, we will be talking about schizophrenia spectrum and psychotic disorders. So I hope this helps. If you have any questions, let me know. But as always, it's a privilege. Thanks. Bye-bye.